Joining me now is Republican Congressman Greg Murphy of North Carolina. Of course, once this passes the Senate, it will head over to the House. And Congressman, thanks for being here. The Senate's bill is expected to raise the deficit by nearly $3.3 trillion, at least by the CBO analysis, which is even more than the House version of the bill. You and I spoke when the House version was being put through. Are you concerned about, I guess, an additional amount to even when the House version was being worked on?
Yeah, Omar, I'll go back to kind of my original statement about CBO. I wish I had faith in them to be able to calculate things. I'm a scientist by nature, and I like things to be well objectified and well researched. I just have a difficult time with CBO. That said, it is problematic. Why is it a higher number than was the House's number as we move forward? There are a lot of things that need to happen between now and when the president signs the bill. Those are some of the questions that are going to have to be answered to reach the desk of the president.
And, one of the major sticking points, so obviously the deficit is something that Senator Ron Johnson seems to be having an issue among others, but him in particular. Yeah. Another sticking point here has been about Medicaid. And as well as anyone, state of North Carolina has an above average enrollment rate in Medicaid, according to the census. And Senator Tom Tillis from your state, who we'll talk about him more in a moment. But he was worried about how Medicaid cuts would hurt his constituents and voted against the bill. If I'm remembering correctly, the last time we spoke, you were okay with the House cuts. Where do you stand on it now in regards to the Senate's, and why do you believe Tillis voted the way he did?
Yeah, so, first of all, the problem that we are facing is that we've had an explosion of government dependence. Medicaid has exploded to an area where it shouldn't be. In fact, the last CMS director, I think her main job was to try to infuse DEI and to enroll as many people on Medicaid as possible. So we have a government program that is no longer working really for the people that it's supposed to be vetted for. I thought the House version was a reasonable version. We went after waste, fraud, abuse. We looked for folks who should not be on the Medicaid rolls, the ineligible, those who are illegal in the country, those who are able-bodied. The Senate has taken a different approach, and not quite sure why. I'm still working through some of this. Rick Scott's amendment on the FMAP is problematic for me if that includes the present expansion population in dropping that down. I don't know whether that's going to be able to pass or not. So, there are things that are problematic. The last thing I want to do is hurt anybody's access to health care, but we also have to be concerned about government explosion of spending and of resources on individuals who do not qualify for that.
And, obviously the concern here, I'm going to bring up the CBO one more time, your favorite group. But, they estimated it would leave nearly 12 million people or so that would be affected by this over the course of implementing this bill. And it's dividing Senate Republicans. We've seen some folks concerned about how that would trickle down to rural hospitals and potentially close those. Also concerns that some folks who actually are under the requirements, they are working, they are able-bodied, that might just get lost in the paperwork of having to report every 6 months. Everybody's lives are busy. But I guess, do you have any concerns about rural hospitals being affected here, even with the amendment for a surplus for those hospitals?
Yeah, so, here I've practiced in Eastern North Carolina going on now, I think, 32 years. We're a very rural, very poor portion of North Carolina. In fact, our recruitment areas, if you put it into a state, would be in one of the poorest states in the country. So it is a major concern. Going back to, you said somebody having to fill out paperwork every 6 months. I'm sorry, if you're getting government benefits, spending a few minutes to make sure that you qualify for them is okay. It's an adult responsibility. So I'm not worried about that. As we move forward, look, that when the CBO says 12 million people won't have, quote, access to health care, these are the individuals, Omar, who are not eligible for Medicaid as it is written right now. These are the things that we saw with the explosion of Medicaid enrollees with the last administration. So again, we want a government program that works for the individuals that it's supposed to work for. Those who are, the impoverished child, the pregnant female, the disabled, or the impoverished elderly individual. Those are what Medicaid is supposed to work for. If we're going to blow it up for everything else, we can't afford that. We simply can't afford that. And those individuals who,
sorry
let me just say one thing. Those individuals who are able-bodied and could get a job, You can get a job these days, and health insurance, the number one provider of health insurance in this country is the private community. So let's push back on that a little bit and push the the victimization and the dependency on the federal government.
Well, I will say too, just even on the frequent work requirement checks, it does create a potential situation where someone could lose their job, or someone could end up in a situation where they can't work for a bit, and just by nature
Sure.
of the way they're caught up, just by nature of the frequency of checking in, they could end up falling off of coverage.
Yeah, I get that, but that's the exception, not the rule. We can't build a government on just small exceptions.
All right. I will take your answer for your word. I want to ask you about the senator of your state because
Yep.
Republican Senator Tom Tillis abruptly announcing he won't seek re-election just hours after President Trump blasted him for voting against the bill. Congressman, I should ask you, are you considering running for that open Senate seat?
Well, I think Senator Tillis did what his conscience dictated. Hey, that's what we all should be doing. I've had my phone's been blowing up today with individuals asking me if I would consider running, and I will take it into consideration. What we have to do right now is try to get this bill squared away, get it done the right way for the American people. There'll be plenty of time for the politics later.
And look, just on that, so it's safe to say you're open to it, still exploring your options. I was just talking with Senator Mark Wayne Mullen earlier, and he told me there's a lot more to Senator Tillis's announcement than just fallout with the president. Do you have a sense of what he might have been talking about there?
I think, I've had several discussions with our senators really, over the last year. It's what we do. It's part of our delegation. I think there has been some disillusionment with the way of Washington, D.C. and the way it's running. Is this a surprise to me that he's announcing this? I can't say that it is a surprise. We have a difficult time in Washington. The politics really run the day. I'd love us to have 100 people in the Senate and 435 in the House that do things for the right reasons because they're the right things to do. We do have our extremes, and I think those things oftentimes dictate policy. What we need are thoughtful individuals that can do bipartisan work, that can reach across the aisle, that can do things that are good for the American people. Yes, we're going to have our proclivities. We're going to have our, things that we agree on and things we don't agree on. But it has gotten so polarized in Washington, D.C. And, truth be told, not pointing out to you directly, Omar, but I think the media has a great part in the disservice of what's happened with our country and how polarized we are right now. So I think it's really, Tillis is not running again. It's more of an indictment of the system than not necessarily an indictment of an individual.
Well, not to you specifically, that some politicians have leaned into some divisions on both sides of the aisle more than others. Just before we go, look, obviously the Senate's working through. They'll do what they need to do. But no matter where it ends up, if it passes, it's going to end up in you all's lap. And the president has put out this sort of self-imposed deadline or hope of July 4th. Given what you've seen so far, are you optimistic that the House will be able to get something from the Senate in time, work through your changes, and get it to the president's desk by then?
Yeah, Omar, I think there are a lot of folks there that have real concerns with what's going on the Senate side. And just being a realist, I'm just going to call things objectively. I'm not sure how that gets to the desk by July the 4th. I want us to have a good product, and I think that's what both chambers want. There are some major concerns by certain individuals. I have one concern personally. I don't like what the Senate has done with the doc fix. We've been pounding our physicians who take care of our patients. And we've lost 30% inflation adjusted over the last 20 years. Not sure why the Senate took out the MEI adjustment, which was foundational for helping physicians still take care of Medicare patients. So again, there are a lot of different segments. Vast majority of the Senate bill is almost identical to the House bill. And I think they strengthened it in some regards, but there are some real questions that are going to have to be answered before that gets to the president's desk.
And we'll see what the final language looks like. Congressman Greg Murphy, really appreciate the time. Thanks for being here.